We're back now with a growing concern over what doctors are seeing in hospitals across the country right now. The triple threat of COVID, the flu, and RSV all hitting at once.
Pediatric hospital beds in 14 states and Washington, D.C. are at more than 80% capacity already into this season. ABC's Alex Presha has the story.
This is becoming a common sight at hospitals across the country. Beds and emergency rooms crowded with sick young patients.
We have a 181-bed hospital, and last night, virtually every bed was full.
Doctors telling us the rise is due to something dubbed a triple-demic: COVID, the flu, and a seasonal virus that mostly affects children called RSV.
The good news is for two of the three, we have vaccines that are highly effective at preventing serious illness: COVID and flu.
But thus far, hospitalizations have been on the rise. Nationally, pediatric bed occupancy is the highest it's been in 2 years, with 75% of an estimated 40,000 beds filled. That's a 4% increase from just last week, according to the U.S. Department of Health and Human Services.
We're looking at and we're really tracking healthcare capacity very, very closely across pediatric hospitals. And obviously, if hospitals need help, we will step in and help them to make sure that all kids across America get the care they need.
The greatest percentage of visits for flu-like illness are for those under 5 years old. Patients like 5-month-old Bentley Phillips, who spent the night hospitalized with RSV in Green Bay, Wisconsin.
It started with the wheezing. He progressed so fast. His oxygen was so low that we don't know what would have happened if we were home any longer than we were.
At Children's Healthcare of Atlanta, they are still pushing the importance of vaccines, reminding parents that it's not too late to get your kids vaccinated, saying that 95% of the hospitalizations there overnight were for children who did not have the flu vaccine and or had incomplete COVID vaccines. Alex Presha, ABC News, Washington.